and we have a set of 1, 2, 3, 4, 5 distinguished panelists. And my name is Nahum Gershon. I work at the Micro Corporation in the US, and I also work in consumer technology, among other things, and also lately I started to think a lot about its applications to medicine. I have some biomedical experience. I used to work at NIH some years ago. So I would like to have the panelists introduce themselves very shortly, 120 characters or less, and I'm counting, okay? And then maybe we'll discuss it and we'll have active participation of the panelists and the audience.
I'm a doctor at Institute for Pulmonary Disease, and I'm pulmonologist, oncologist. I work with lung cancer patients in daily hospital with cytotoxic therapy and with patients on the radiotherapy.
I work in the health center of Novi Sad. Is open clinic for patients. My specialist for physical medicine and rehabilitation. There's not only pain in back. There's a condition which requires rehabilitation after trauma, after orthopedic treatment. We have a patient from children to old people, and there is a very different pathology we manage and rehabilitate.
My name is Nemanja Kovačev. I'm an orthopedic and trauma surgeon and also a programmer. Currently I'm working as a programmer full-time at the RTRK Institute. Okay. Thank you.
I am Gabriele Foresi. I am a researcher. In particular, I am a data scientist and software developer. In particular, I collaborate with the Department of Medicine in the University Politecnico Marche in Italy, and I try to use particular engineering techniques to apply them in the medicine scenario. Thank you very much.
Hi, my name is Lucio Ciabattoni. I'm the chair of the Italian chapter of the Consumer Electronics Society. I'm an engineer collaborating also with the Department of Neurorehabilitation in a medicine hospital in Italy, in Ancona, in the Marche region, where I showed the video this morning.
Thank you. My name is Milenko Beric. I'm coming from RTRK. I'm one of the co-founders of the institute. RTRK is, I think everybody knows what RTRK is, but just in simple words, it's the leading consumer R&D facility in Southeast Europe, both from the business point of view and I think also from the R&D point of view.
Does anybody of you have some devices that can measure medical parameters of your body? No?
Basic ones.
What?
The basic one, the heart rate.
Yeah. So what does it measure?
Heart rate and steps. Heart rate.
Heart rate and steps.
Stairs.
Same. Steps. That's it? Okay. You have any medical device on you, or any device that could measure some medical parameters of your aging body? Fitbit, okay. Okay, so maybe I'm an exception. I have Fitbit, okay. I also have the Apple Watch, and I can actually, at any moment, can get my EKG and have it sent to my doctor, okay. And it's blessed by the FDA in the US, so it's actually reasonable quality. And also, if I fall and I don't get up within 2 minutes, it will ask me, did you just fall? And if I don't answer, it will call the ambulance. Okay? So, a while ago, the sink in the kitchen was clogged, okay? And I took it with my left hand, I'm left-handed, and I banged it on the trash can so I can get rid of the junk. And they asked me, did you just fall? Okay. And of course I said no. After a few days, I was going to the supermarket, and as I'm trying to go to cross a driveway, I see a woman is driving slowly, and she looks to the left where the traffic is coming. She doesn't look on the right when I'm coming. She almost ran me over. So when she kind of went slow and by me, I banged on her car so she would learn a lesson. And no, because she could make a disaster. And then my watch asked me, did you just fall? Okay. So that maybe signify one of the troubles with engineers, and you mentioned it in your talk, that the body is a system. If I want to measure the blood, the heartbeat, I can measure it in any point of my body, more or less the same number. But if I want to determine if I fell, I need more than one sensor. Okay, I need a sensor here, and maybe here. Okay, but it looks like engineers don't think much about it. Okay, so this is just like one of the difficulty. Any other difficulty you see with the situation where you will have many devices on you and it will measure, Yes?
I have to disagree with the last statement that the engineers didn't think about the things. It might be that they just had a deadline.
The what?
A deadline. I think the engineers here know what the deadline is and how it can be pleasurable. And then you just look at the results and you say it's close enough and you accept it. And I said, okay, if we have several cases like this, bang on a car, it says, did you fall? We will make it better next time in a next version of software update or some patch or something.
Yeah, or it's not just patch. You will have to have more than one sensor to determine in your body.
Or that we will upgrade the device.
Yeah. Oh, it's very good right now. It's very good if you're an old person and you really fall. It's good, right? But for me, that I usually don't fall, right? I just bang cars. It's not so good.
There is whispering from the audience. Sorry, it's cost effective. What you have, it's cost effective. So if it's cost effective, it cannot be perfect.
It's effective for some people.
Yeah, but there is also another point, because I might consider wearing a sensor in here, but not in other parts of my body. So that could be another reason as well.
No, you need more than one sensor.
Yeah.
A system, yeah.
Yes, but I might not want to wear something on my head.
No, a sensor. No, but the sensor could be small. Could be on your pants, or you could be in your shoes, right? And you could be on your other hand here on your sleeves, right? There are many ways to, in the future at least, to put sensors. Could be in your eyeglasses. Okay, or maybe if a woman has a pin here on her hair, it could have the sensor too. Any comment? I think this work. It should work.
Yeah.
Yes.
Well, it's not a comment, it's more a question, I think, for the doctors that we have here, because what you just mentioned actually opens an interesting point, and that's what would the doctor do if somebody comes and gives them 2 years of your EKG data to assess and handle, because doctors are usually used to getting, samples from time to time, and you come to visit them, and now all of a sudden you come with so much data about yourself that I'm not sure that how today's medical professionals can actually handle and process this data that's going to be all of a sudden available about yourself, for example. That's a whole other set of problems that we are going to face.
Right.
It's a question basically for doctors, what do you do with all that data now, which was never available to you before?
We must see all the data.
Turn on the microphone.
History of this, when it happens, when something goes wrong. We must see all the data significant for the patient.
I think this is clear, but I'm saying people are now going to start monitoring themselves all the time. Basically, you have a full year of continuous EKG, or...
We must have a program which
you have to,
will
basically, that's
choose
the
what
point
is
now. A whole
significant,
new
what
set
is
of
not
problems are going
significant
to be
findings.
created because of that.
Yes.
That needs to be solved at the end.
Yeah, but for example, if you live far away, let's say in the US, some people like to live far away, and it takes you 2 hours to drive to a doctor. If you feel bad in the morning, you will scan your skin, your throat, your ear, and you send it to the doctor, and the doctor will come online on your cell phone and will tell you, oh, I think that it's probably not too bad. You just go to sleep and drink tea and call me tomorrow morning if you still feel bad, or come immediately, or send an ambulance immediately, right?
We need more and more we ask more and more questions, and we need more information to differ. Is this something significant or not significant? Yeah. Is this only a flu or something serious?
But there's another issue. When I go to a doctor, he or she looks at me and look at my skin. For example, I said, oh, I have swollen lips. When the doctor will see me, he will see that I have maybe a swollen here, something on my ear. And I didn't notice it, but the doctor will see it, and for the doctor it will mean something. So that's what we lose by not seeing a doctor. In addition, I think once there was a research done that the personal presence of a human being talking with you sometimes helps you more than the medicine. Sometimes, not always. You know, the person. I had my own experience once with that. You know, I think I mentioned before to some people that the doctor was not interested very much, not actually look at me. My acupuncturist, actually, she was the human being behind the desk, okay? So there is something to the human contact that is very important, and it's not
to look in his eyes.
And it's not present with this or with my cell phone or whatever. Yeah, so that's an issue that maybe we'll have to solve. Maybe one day, you know, like virtual reality will be so good, but still there is also the personal interaction that is, we don't exactly understand it, how human beings interact. It's not just mechanical. Once I give you the view, it's just that the presence, the physical presence with another human being that might actually help, not just somebody far away appears on my screen. Any questions, Carl?
It was more a comment than a question. I think that the key point is that we are not trying to replace doctors or physical contact. We are trying to help in something they maybe cannot see. I mean, for example, we work on analyzing data of smartwatches for Parkinsonian patients. Basically, what happens is that tremors and dyskinesia, which are the non-voluntary movements, can be monitored only when they go to the doctor for the visit, but this happens once a month, twice a month. But the evolution can be monitored by using, for example, this accelerometer data. So basically, the doctors can adjust the dose of the medicine by having this data, basically a report based on this data. So it's something which can help, not perfectly replace.
I agree with you.
And another thing about the number of sensors to be placed on the body and whatever, I think that here we should also make a difference between a medical device, which can be included in kind of a taboo area, which label a patient as a patient, and a consumer electronic device like a smartphone or a smartwatch, which on the contrary can help a patient to feel more like a non-patient. I don't know if I'm clear.
Yeah, I agree with you.
And in this case, if you have a consumer electronic device, a mass-use device, we cannot ask for 100% of precision.
That's true, but wait until, at least in the US, the insurance companies will discover it, and already started to discover it. By me making the test on me, it costs them less than if the doctor is doing for me. So they will not let me see a doctor soon, you will see it, unless I do all the tests on myself. You see what I mean? So the first stage would be I have to do the test on myself, and then if a doctor determines that I need to see a doctor, they will let me see a doctor. And I'm sure that there will be cases where the test will miss something because a human being didn't see you, didn't interact with you. But the insurance companies are interested not in my health, they're interested in their money. Okay, so, any comments?
This is not a question, this is a simple comment. The goal is to explore the technology in order to help the user In particular, we faced with a particular application by using two simple devices, a mobile robot and a smartphone. This mobile robot randomly moves in the home, and if the user falls, through a RGB camera, it's possible to take pictures and send this picture to, for example, a bot Telegram to alert his family, for example, when the user is alone at home, instead of driving 2 hours for reaching the doctor. In order to save time and why not save life?
I would like first to reply to Milenko's question about those big data, about ECG and other parameters. In the last few years, health tech has gone a long way, and the amount of data available for doctors is really enormous. And the point is that this amount of data has to be accompanied by a software, by AI methods, who would handle all that data and pinpoint any significant bad result or anything in that sea of data. Because if you have an ECG for 2 years, it's really difficult for a person to go through all of these ECG scans. So AI is developing now rapidly, so I think it will be accompanied, that amount of data will be accompanied by AI methods, so it will be easier for doctors to do their job. So this is just my comments.
Any comments? Don't be shy. Yes? 1 second, I'm going to bring my microphone.
Hello. I come from automotive industry, where I find similarities, because what we are dealing, half of our work time is actually diagnostic. How to test and how detect failures in the car from the perspective to make it more safe. And then the critical thing for us is not to deal with crucial information through the bunch of unuseful data collected over driving for I don't know, few years, but actually to protect ourselves from false positives. So in order to think about having any diagnostic for human beings and a remote collection of data or whatever, first thing we need to be sure that those data are valid, so the device is not wrong. This is the first thing. So consumer devices which will serve to diagnose the human body, and first of all, it cannot be consumer device. Because in the case of consumer devices, nobody is taking, everybody are optimizing costs, but nobody is taking care about the quality of data which are collected, and they need to be trusted. You can imagine that, I don't know, there is a heavy T-storm around, and suddenly all consumer devices are reporting that everybody are ill. But there will be still few people which are really sick because of that one. And this is the first thing. We need to take care about measures to verify data and to ensure that only valid data reach doctors. If you have a bunch of untrusted data, then those are untrusted data. That's what I wanted to say. Thank you.
Yeah, in the US, the government approves medical devices. So, for example, in my watch, the EKG is blessed by FDA. Okay. Yeah. So what happened is, and why it has become so, the issue so popular, not only because we have now more devices, but also the quality of the devices has improved tremendously since maybe 10 years ago. Okay. For example, when I go with a Fitbit to my steps, it's not very accurate. People ask me, why do you have a Fitbit and a watch? I say, the Fitbit is more accurate as far as the number of flights of stairs that I climb, and the Apple Watch is more accurate with the number of steps. Okay, and I measured it. Okay, but the EKG device here is relatively accurate, and the FDA accepted it. But you're right, that's a big problem, and I'm sure that in the next few years the situation will become much better. Another issue that I think about sometimes, what about if I'm a hypochondriac, okay? So I'll do EKG every 5 minutes, right? And if I measure, let's say, the sugar level in my blood or something like that, and if I'm hypochondriac, so that's a problem that it might be a problem for some people. So what do we do?
Your device will alarm all the time.
The what?
Your medical device will alarm all the time.
Yeah. Nothing, maybe they could program the device that I could not measure it more than once a day, let's say, okay?
Yes,
Or would not tell me the numbers only once a day or something like that.
I think that's a problem.
Maybe they would send the doctor the numbers if the numbers are suspicious, right? But I would not...
We must differ what is significant, what is not significant findings,
right.
and alarm to ring only on significant findings.
Yeah. Any comments? Any hypochondriac here? No? We didn't let them in. That's my card. Any comments? Suggestions? What about you guys? Yes, you have a suggestion.
About the device sending all the time your medical data to doctor. Well, this is what I said a little earlier, that AI or software which will accompany those devices in the future will decide if it's relevant or irrelevant to send a doctor at all. So if the finding is irrelevant, it won't be sent to a doctor. So I believe that will be solved in the next 2 years. So, but I would like to comment and to ask a question. What if a device sets diagnosis, sets a bad diagnosis, a wrong diagnosis, and the doctor do according to that wrong diagnosis, and something happens to the patient? Who would be legally responsible? A doctor, attending doctor, or a coder who coded that particular line of code which caused the device to malfunction? So that's an issue which would have to be addressed in next 2 years with the development.
We talk about that later.
Yeah.
About robotic surgery.
They would let you sign a document that you release the responsibility of the doctor if the device is malfunctioning. Right? Right now, when you go to a doctor,
well, that's...
then of course you can sue them for $1 million.
But device may mechanically work correctly, but can conclude a bad diagnosis.
But this, sorry to interrupt, but this I think goes back to what, in a way, colleague from RTRK commented, and that's, there is a big scale problem, small scale problem. Of course, there are going to be what you call them false positives or some kind of AI which you cannot really interpret the results correctly at the end, which are going to result in unfortunate accidents at the end. Yeah. But overall, the idea is that we are all better off because of the technology. So of course, it's to put it in the, I would say, traditional terms, a bit like a vaccination at the end. You know, there are going to be bad examples, but society as a whole should benefit from the improvements.
Yes, of course.
Yes, we talk in the whole. Will you allow a robot to make operation on you? What about the robot falls?
The robot?
Who will be responsible for that?
You know, some of the doctors that I encountered in the U.S. were worse than robots. Sometimes,
yes.
you know.
Yes,
but you're right.
In my opinion, it is only when the surgeons are tired and just for some simple interventions, not for the whole operation.
Yeah, it could be. Maybe it would be a situation where the robots would be more trustworthy.
It is for the long-lasting surgery, and when the surgeons are tired, then to put the robot. No. Yeah, I'm not.
There are some type of surgeries that are done remotely. You know, the doctor is on one side, 2,000 miles away, 2,000 kilometers away, and
yes.
machine does the operation.
Yes.
I don't like.
Will you allow that?
Yeah, yeah. Well,
I'm not.
we'll see. But I believe also that the presence of the human being is very important. Even when
Yes.
there is an operation on me.
Just to look around.
Done by a human being versus a machine. Right? Any more comment? Any comments? And I saw a few years ago, I went to a maker fair, you know, the maker movement that lets people invent all kinds of things at home. And there was a group of people who were actually technicians in the hospital, and they like to play around, and they built all kinds of devices. One device was, for example, when you have to measure how effective the breathing is. So typically you leave a patient at the hospital, but they built a device so the patient could go home, and every hour he does that breathing test. And the device was looking really homemade. You know, they used an empty milk bottle for that, for example. And the device is such that if you forget to do it every hour, the doctor will call you, hey, you forgot to do the test. So you can actually release patients from hospitals earlier. And it's good, A, for medical expenses, but also, you know, people get all kinds of diseases in hospital. You know, hospitals are very, very dangerous for you. You can get lots of infections, unfortunately.
Yes.
At least in the US, I don't know how it is here. So, so that the device actually could be very helpful, but it's a very limited device for only one purpose. And the patient who is being released is actually healthy otherwise. I mean, he's in good shape, but still needs to check his breathing. So that's another example where the use of consumer technology devices could be very helpful.
Yes, it can alarm to introduce a medicine, and
The what?
patient will be at home and receive
Yeah,
the
at
medicine,
home.
and there is no need for hospital.
Yeah, no need to be in a hospital.
Yes.
And especially some patients have, let's say older patients, have a caretaker, like another person who takes care of them. They're not a physician, maybe a nurse or something like that.
Yeah.
So they are with them, and the tests that they need to do, or the devices, they can use the quote-unquote consumer technology devices, and that will help them, you know, be there. And if there's any
To perform
problem,
the test.
The healthcare, the person could call the physician and talk with them about it. Yes, you have something to say? No?
No, let's go further. You are talking about something which can happen in 3 years,
Yeah.
2 years.
Yeah, it's already partially happening.
Yeah.
Partially happening.
What about human-like personal robots in home?
Personal robot?
Yeah, human-like nurses,
Yeah.
personal nurses.
If you want to use it, you can use it. He has been working with computers too much. And I'm sure he doesn't use a Mac, he uses a PC, right?
No, exactly.
Use a Mac?
No, I don't.
Oh, you see. I told you. Any comments, suggestions? Who is going to buy an Apple Watch in the next few days? No? Is it very expensive in Serbia? No? Oh, you don't know? How many people have a Fitbit on them? To count the number of steps. I know you do. Yeah, you have a great device. Who else? You have one. You have one. Yeah. I find, by the way, I find that the Fitbit, having a Fitbit and counting my steps, even if it doesn't count it exactly, but the fact that every day I look on my watch and I said, oh, it's 12 noon and I only did 2,000 steps. I need to do 10,000 steps a day. So I did only 5 floors and only 2,000 steps. I need to do something. So basically it convinces, whether the number is exactly right or not, it convinces me to be active. And the result, I'm active, okay? And I know I did measurements, evaluated those devices, and not all the time all accurate, but it convinces me to be active, and that's a very big blessing for me. you know, so that's maybe another aspect of those devices when it's not a medical question, just that it entices you to be active and to do physical activity, and that's where you will be hopefully healthier.
I had the opposite situation. Once I had a Microsoft band, measuring Microsoft band. It was like a Fitbit.
I know,
display.
I had one. I evaluated it.
Yeah, many sensors, not so bad, but then they cut in the production. I have it. And a couple of weeks, I had your same problem. Oh, it's half of the day, and I just had 2,000 steps. And I need to do something, and I took off my band and I put it on a desk.
Yeah.
So no one can know how many steps I'm actually doing. This is another point of view. I mean, you can be more pushed to be active, or you can be more pushed to be suspicious of this technology.
Of technology? Yeah, you can be suspicious if you want to, but so what if the CIA would know how many steps you take a day? Or how many flights of stairs you took? Okay. Okay, so I feel that I don't care that they would know how many steps I'm doing, as long as, you know, I feel healthier. Okay, and by the way, the Microsoft band, I evaluated it, and after 2 weeks, I returned it to the store. You know, they stopped producing it. It was not very good instruments, okay? By the way, so you probably, Fitbit is more popular, okay? And by the way, I'm not a Microsoft fan, so when I returned it, I told the Microsoft store, I told them, now I have to go home and disinfect my house, because I don't have any... They didn't laugh, unfortunately. But I find this is for me, it's a blessing, absolutely a blessing. You know, monitoring my activity. And, you know, if you want to know, today I did already maybe 18 floors already or something like that.
I mean, I was basically provoking. It was like, can someone feel stressed or more, I mean, constricted by technology? I say, I have a hard work and I cannot perform 10,000 steps a day.
So you can do other things. You can do other things. First of all, you know, for example, sitting, they say, that's the other thing. You know, sitting is not so good for you. For example, both of them tell me after a while, oh, it's time to get up. I usually don't sit much. At my office, I have a sitting computer and I have another computer which is standing. So I go back and forth. In my office, I don't have a trash can. Everything I need to throw, even a little wrapper, I'm going to the central trash can. That's how I get. So you have to maybe plan your life in a way that you will be more active. So I don't like to sit for a long time, you know. So and you know, if you have some limitations, you can find other things. For example, I read a book called You Are Your Own Best Medicine. It was written by a French doctor, and he tells you to walk every day 3 kilometers in 30 minutes. Okay, it's fast. It's good for your heart. And it says if you have motion problems, some people cannot walk that fast. You can increase your heart rate by doing exercises. You know,
with arms,
with your weights here, and it might get the same effect as long as your heart is going to pump intensively for a certain amount of time. So you can find things. You can find things. And if you sit on a wheelchair, you can also find ways to become active. And those devices could help you, because you know, otherwise you will not know how active you are. For me, it's a big blessing. Any comments? Any closing statements? Yes.
I just wanted to remind you of something. Do you remember when we discussed about the panel and talk and subjects, and you said, lucky that I'm not hypochondriac?
Yeah.
So having those devices, if you're a hypochondriac, well, it might not be that good, right?
So for in that case, I would recommend you to see a psychologist or a psychiatrist, okay? Not a remote one, not through your telephone, but actually see in person.
Eyes to eyes.
You know, And actually, in spite of the bad names that psychology, psychiatry has, and you know, not all the people in that profession are very effective, but some people are very effective. And if you have a problem, it's an issue, see somebody and talk about it, and maybe you'll improve.
Exactly. So,
And you have a device, if you haven't seen your psychologist for 2 weeks, you tell you, oh, you haven't seen psychology for 2 weeks, it's time to see him or her.
yeah. Or you can have artificial intelligence like Sophia is.
Artificial intelligence, I think,
Psychologist.
in spite of the talk that we had today, I don't think we are there yet because they don't
I
have
agree
much
with
common
that.
sense
Yes.
yet. Maybe they will have. It's better maybe than nothing, but I would prefer, that's my personal preference, to see a person.
Or you can talk with a friend.
But again, you need to change so a friend is not necessarily knows, the friend might be very, compassionate, a nice person, but the person doesn't know how to talk with the person with that particular problem and convince that person to change and actually guide the change process. So yeah, it's good, always good to talk to other people and to have this person-to-person communication, but in that case, I know that because I had some problems in my family that and sometimes you need to see a professional that knows actually specifically how to deal with those particular problems. But friends are always good.
You know, when you have so many devices and they give you so many alarms and some of them might be a false positive, or even if the device is not correctly, software is not really, like you have really cheap software or something, and all of a sudden you get lots of false positives and you become hypochondriac because of the device. Is that possible? Maybe the doctors can tell us.
There's a virus.
Like
There's a virus. It's all connected.
Device-induced hypochondria.
I think the bigger problem are false negatives.
For life-threatening situations, if my Fitbit will tell me 4,000 steps instead of 12,000, it's a problem, but not a terrible problem, right? But if there is something more serious and there is a virus, especially those instruments are connected, that's a very, very important issue. What you say, the cyber, quote-unquote, cybersecurity.
If it's cybersecurity, it could be
And
other
also defect.
virus, it could be that software is cheap, or it could be student exercise written software.
Yeah.
So.
Any more comments? Going once, going twice, done. Thank you very much, and thank you very much for you all attending and listening and asking some questions. Okay, maybe next time we'll have more questions, but it has been good. Thank you very much.